know, in South Africa, we have problems of human resources for health, which is the health workforce.
What we were trying to understand is in a little bit more detail the dynamics of health worker movement.
As a country, we don't know much about how many health workers we have, where they are, and how they are distributed in the country.
We were trying to look at starting with students, but really try and follow their progress and their decisions over time.
Our study was conducted in 2 provinces, Northwest and Gauteng province. Northwest mainly because of its rural nature and Gauteng mainly because of its urban nature. Everyone wants everything from a nurse, you know. When a doctor, when a specialist, when a manager, everybody wants everything from a nurse. So those are some of the things that we take maybe for granted, but they tend to take a lot from nurses.
When they come here, they look at the nurse who should give me a perfect service. But with the numbers that are coming in, with the equipment that is so inadequate, the nurse cannot execute the service properly.
In the clinic, there are no equipments. Gore re na le toilets tse pedi engwe ga bereke sentle. Ke di toilets tse leng gore ke tsa balwetse, ke a balwetse le staff. And then ha gona di basins mo di consulting room. So we have to go from here to wash our hands outside.
Our facility is exceptionally well managed, but the problems which come from outside the scope of that management, stock problems. It's hard not having the necessary medicines. It's hard not having the necessary equipment.
Ha gona le bothata ba ditlhare. Nako nngwe re tlabe re kopa taxi driver or mo itseng gore ka gore wa go feta borakallo re kopa gore o re tsamele ka setlhare sa gore go borakallo. Then le ene ga a boa kwa ga boa gape kwa ba borakallo le bone ba tla ba monela gore tsaonele ba go motswedi.
When we started the study in 2008, there was quite a strong discourse amongst people looking at human resources for health.
Everybody was talking that people are leaving the public sector.
What we found was then that in fact a lot more nurses than we expected stay in South Africa, and that still quite a significant proportion were working in the public sector.
I don't think we expected that a rural retention and public sector retention would be so high. I think it is encouraging that people are still remaining in the public sector regardless of the complaints that they do have. Resilience, I would say, is the ability of the health workers or these nurses to maintain personal and professional well-being in the face of adversity.
Resilience is making these decisions about where you work, expressing a commitment and being able to try and improve things yourself rather than just complaining and blaming the government or your managers for not delivering better working conditions.
In these circumstances, the patient comes first after all, you know. So they have to find ways of still maintaining quality of care or improving provision of care regardless of the circumstances or the difficult conditions that they may face in their daily work.
It's rewarding work and it's important work. I feel that it's important. I can offer a good service to anyone who needs it. I don't ever have to ask anyone for payment. I don't ever have to look at anyone's medical aid card. The service is the same for everyone, and I feel that that's important.
I stay because of the love of the people. If I manage 80% of my patients to be happy, I come out of the facility very jubilant every day. You suspect you are 8 months.
There are a number of things that influence behavior, and we were interested, I suppose, in financial incentives and counterbalancing that with a whole range of other non-financial aspects related to wanting to do a good job, some commitment to the public sector or wanting to help patients. So we're trying to balance, trying to understand it. That informs a lot of our research.
Small things like appreciation by the community.
Sometimes o tla bo sa itse le gore motho o kile a tla le ko go wena a tla go appreciate tiro ya gago gore o mo thusitse o fodile.
Reminding you of how you helped them, regardless of you remembering even their names and all that, that those were some of the smaller and softer things that they thought were quite valuable.
Boitumelo jwa community e ke e berekang ke boitumelo jwa ka, so ga ke le mo go yone ke feel gore ke mo bathong ba ke tshwanetseng ke nne mo go bone.
In a clinic setting especially, the nurses expressed the ability to exercise discretion as one of the important things to them while they stayed.
I love to be my own nurse. I love to depend on the skills, the knowledge that I've acquired, the experience.
I enjoy not having to answer and ask permission and being able to do the job that I know I'm capable of doing, that I have been trained for.
So with the hospitals, you have to rely on the doctor. The doctor has to prescribe. The doctor has to put in the drip. The doctor has to put in the catheter. The doctor has to draw blood. But with me, I do everything down here.
Over time, the nurses in our study have been moving out of hospitals because of more stable and more identifiable working hours. But also I think they feel like more responsible for their work in those settings. They're much more independent. They're not just doing what the doctor tells them to do.
The other thing, maybe health sector related, would be supportive supervisors that are interested in pursuing, encouraging you to build yourself and develop yourself within the clinical expertise.
I told my boss that I was interested in training for a clinical speciality, and I was given that opportunity.
In environments where they were provided with such opportunities, they remained.
Go nna gape go nthusa mo gore ke kgona go tsena le dikolo ga ke lefa, because ke bereka 7 days in, 7 days off. So 7 days off ya ka ke kgona go dira dilo tse dintsi ka yone. Ke kgona go attenda sekolo, ke kgona go dira my businesses. Be ke kgona go tswella mo botshelong.
The main things we found were educational opportunities, more flexible working conditions. The difficulty, of course, for managers and for government is it's difficult to always accommodate everybody's needs all of the time. But at the moment, there's almost no attempt to try and at least give people their preferences.
So I think this study is very useful to policymakers in the sense that it provides them with information about things that they may need to strengthen as part of the interventions of trying to retain the nurses in the public sector and in rural areas.
Some of the evidence is things that we already know, but we don't necessarily look at it as evidence, but suddenly when it is packaged, by researchers, then it does look like real evidence. What the research revealed was that some of the solutions are solutions that are quick wins. Simple things, like for instance, issues around training.
We found that nurses that are born in rural areas and that were trained in a rural province, which is northwest in the instance of our project, were more likely to be retained in a rural area.
So that's a key policy initiative that needs to be supported.
What I think is possible is for us to actually prioritize training opportunities to those that are in those environments, so that we can attract more.
But there are a whole lot of other things that we found in our research that are, as important or sometimes even more important. Some of the non-financial things, which of course easier for the government to do, they don't cost as much money.
I guess there are some of the personal factors. Being committed to the profession, that is a personal value thing,
I'm a community person, very engaged in the community.
I had absolutely no reason to leave.
There are those nurses that strongly feel that, I love nursing. I cannot do otherwise. This is the profession that I've loved from when I was young. So whether the circumstances can be as adverse as they are or worse, they will still remain in nursing because they have that love for the profession.